All right, everyone, today I want to walk you through a pattern we are seeing more frequently in clinical practice, and one that confuses everyone. The key teaching point today is this: prediabetes is not simply a disease of sugar intake, it is a disease of metabolic stress. By the end of this discussion, you should be able to explain why a patient who appears healthy can still develop impaired glucose regulation, and why focusing only on dietary sugar is an incomplete approach. What is the most common misconception today? It's believing that minor symptoms are harmless. Early detection is key. Most people believe that blood glucose levels rise only because of sugar consumption. However, glucose homeostasis is governed primarily by hormonal regulation, not moral behavior around food. The liver produces glucose. Cortisol raises glucose. Inflammation impairs insulin signaling. Muscle tissue disposes of glucose. Therefore, one can restrict sugar and still have elevated fasting glucose. What are the main overlooked drivers? Let's begin with chronic stress. From a physiological standpoint, cortisol is anti-insulin. Under perceived threat, the body prioritizes survival. Cortisol stimulates gluconeogenesis. The liver releases glucose into the bloodstream. This mechanism is adaptive in acute danger, but pathological when activated daily by psychological stress. Sleep deprivation, managing insulin resistance is crucial. We need to put both in check for your health. Sleep is not a lifestyle preference, it is a metabolic regulator. Sleep deprivation increases insulin resistance independent of diet. Even one night of poor sleep can elevate fasting glucose the following morning. Next is ultra-processed health foods. It is metabolic confusion caused by ultra-processed foods marketed as healthy. Examples: protein bars, low-fat yogurts, plant milks, artificial sweeteners. These foods disrupt insulin signaling, alter the gut microbiome, and provoke inflammatory responses. Patients read labels. Their pancreas responds to physiology. Again, one of the most under-taught concepts in metabolic medicine is skeletal muscle. Muscle tissue is the primary site of glucose uptake. Loss of muscle mass, even in thin individuals, reduces glucose clearance from the bloodstream. A patient can be lean and metabolically unfit. The gut is not a passive organ. It plays a dynamic role in our overall health. Gut dysbiosis increases intestinal permeability, systemic inflammation, and insulin resistance. Key contributors are antibiotic overuse, artificial sweeteners, chronic stress, poor fiber intake. A compromised gut communicates metabolic distress long before blood sugar numbers rise. Some of the early warning signs we should be aware of are post-meal fatigue, central weight gain, brain fog, sugar cravings, and waking at night. These are not personality flaws. They are metabolic signals. At this stage, intervention is preventative, not pharmacological. Carbohydrate restriction alone is rarely sufficient. You cannot diet your way out of hormonal dysregulation. In summary, prediabetes in healthy individuals is driven by stress physiology, sleep deprivation. If this explanation clarified something for you, I encourage you to stay connected. Education changes outcomes. Don't forget to subscribe. It's essential for your health to stay informed. This will help you manage your care effectively. Remain blessed.